Here at Northwest Pet Clinic, we understand that surgery day can be a day that's kind of worrisome for the pet family. The pet has to be away from them for a significant part of the day, and of course, the anesthesia can be a frightening word for some families. So, at Northwest Pet Clinic, we take the time to educate our families about the process of surgery and anesthesia and the protocols and safety precautions that we use for our patients to help alleviate these worries. So on surgery day, when our patients arrive, we draw blood to perform a pre-anesthetic blood panel. This helps us to know if the major organs that are going to process the drugs are functioning well, and also to look for anemia, infection, make sure the platelets, which are the blood clotting cells, are functional and we have plenty of them, all in an effort to make sure that each pet is a good candidate for anesthesia and surgery. We also run a pre-anesthetic EKG that helps us to know if the heart's electrical activity and the heart rate and rhythm are normal, again, as a precaution to make sure that they're going to be okay under anesthesia. We use the most advanced and newest short-acting, very safe anesthetic drugs. And we do anesthesia in a process, in a series of steps, so that if anything doesn't seem right along the way, we know about it and we can intervene. So our patients receive an intravenous catheter so that we can administer drugs for both safety and for comfort. We give them an anti-vomiting, anti-nausea injection before we give them anything else, just in case it might make them feel sick. Then we give them some pain reliever and a nice anti-anxiety medication because the pets are worried about being there too a little bit. So once they are nice and relaxed, then the next step would be to induce the anesthesia. So again, we use the safe short-acting drugs, and we also have our monitoring equipment in place. So while the patient is being prepped and going under anesthesia, we know their blood pressure, their heart rate, their EKG, their oxygen levels, etc. So these are all the steps and precautions that we take to make anesthesia as safe as possible. Once we have our patient under anesthesia and we have all our monitoring equipment in place and we feel like the patient is stable and ready, we wrap them up in a warming blanket, or we place them on top of a warming blanket if they're too big to be wrapped, to maintain body temperature and comfort during the procedure. So whether we're going to be taking x-rays of teeth and cleaning them and potentially removing teeth, or if we're going to be spaying or neutering or doing any other kind of a routine surgery, anesthesia is anesthesia, and it happens the same way every time, whether the surgery takes 5 minutes or 3 hours. We also provide pain relief, not only with our pre-anesthetic injections, but with local anesthesia as well. We do nerve blocks as often as is possible to help the pet to really not even perceive the pain of the procedure that we're doing. So once the procedure is finished, we slowly recover them by turning their gas levels down and allowing them to wake up slowly and calmly while they're still being kept warm and being taken care of by a technician. So a technician sits with the pet until it's fully recovered and extubated. And then we have our ICU technicians take it from there. They will regularly monitor the patient's body temperature and heart rate and respiratory rate, as well as just checking on them, making sure that they're comfortable and that everything is stable. We always keep our patients for a couple of hours after they recover to make sure there are no complications, and then they go home with their anxiously awaiting owners. So we really feel like with all of our steps and protocols that we take, that even though anesthesia and surgery day is not anybody's favorite day, it still gets the job done in a way that's safe and comfortable for everyone.